Live. Nice. Assalamu alaikum, ladies and gentlemen. Welcome to this episode of Health is Wealth, a show focused on healthcare technology brought by CxO Global Forum, Pakistan's largest C-level forum. This episode in particular is brought to you by Ailaaj, Pakistan's first full stack digital healthcare platform, and in conjunction with CoLab, the venue of this event that decided to partner with us. So I have decided to call a panel, which I've also been told is going to be CoLab's first ever live streamed event, and the first physical panel for the show Health is Wealth, in which I've invited three very budding personalities from the healthcare space in Pakistan. So in order from how they're seated, the first person I'd like to introduce is Osman Waheed, President of Ferozsons Laboratories. The second is Dr. Javed Akram, Vice Chancellor of University of Health Sciences. And the third is Hyder, Mumtaz, the CEO of Ailaaj. So I'd like to welcome you to the show. And I'd like to kick off this segment by primarily asking all of you, in the midst of what's happened in healthcare technology from a startup point of view, our ecosystem has raised $300 million in the past year, of which healthcare startups also got their fair share of funding. So I'd like to ask each and every one of you what your role has been in developing healthcare technology as a whole in Pakistan.
Thank you very much. It's okay, Javed. Hey, thank you very much. So, we don't have a direct role promoting technology in Pakistan, but peripherally work with partners like Boston Scientific Corporation, where we're working with a new company in Alpha called Butterfly, to bring some really exciting point of care technology. And then another line of growth involved, which is doing a lot of interesting work in AI and cancer diagnosis. So Pakistan has, I think, a very interesting tipping point, where, as you said, some reasonable amount of money has started coming in, and there's lots of local innovation that's just about either happening or just about to take off.
Hello? Hello?
Okay. I think you have the mic.
Bismillahirrahmanirrahim. Thank you so much to Bilal and Hyder for the opportunity. Healthcare nowadays cannot be imagined without technology. It is impossible if you look at any aspect of healthcare. My university, which is University of Health Sciences, is the largest public sector university of the part of the world, having more than 132 hospitals in different parts of Pakistan. And it's, of course, the biggest challenge is to connect them together. And then we have also a student body which consists of medical students, dental students, nursing students, and allied health students like physiotherapy, pharmacy, and so on. So, to connect all of them, the only way of going is technology. Uh, so my university realized that a couple of years ago that not only we need technology in healthcare to deliver, but also you empower with technology the nurses, especially the allied health, and to some extent the doctors and dentists also. It's important to not only include technology and information technology and artificial intelligence in our curricula, but also to come up with the master trainers in IT. So we started with the health informatics program, which is a 4-year program. Any nurse, doctor, allied health specialist, or a dentist can take it up after bachelor's, and then we give a master's degree. And the pandemic, which we are in the middle, we are still unfortunately struggling to end. the pandemic made it much more important because when the pandemic struck us in March, Pakistan, March 2020, we had to shut down all our OPD, outpatients in all aspects, 134 hospitals. That to us uh, meant that patients of diabetes, hypertension, heart disease, and arthritis will be devoid of their physician, and thus the follow-up will suffer. So we replaced all the OPD consultations with the telemedicine. And telemedicine, people never knew about telemedicine. They thought it's only a video conference. But telemedicine is much more than that. So we started a program of 6 months in telemedicine, which now is one of the modules of health informatics. Obviously, telemedicine means teleconsultation, but also teleradiology. If you want to look at the X-ray, MR, everything. For most of the machines that we use, they are fax enabled. It's not possible if you're not literate with the IT system or you're not computer literate, you cannot operate or cannot interpret anything out of it. And then also telepathology is there that so distance now has squeezed and it does not it become meaningless. If you can every night that people consult me from all over the world for whatever from US, UK, anywhere, uh, and similarly our patients are consulting physicians all over the world. Except for time difference, that is the constraint, 12-hour time difference, but otherwise it becomes far more easy. I asked them to put a stethoscope there and I listen to their heart. If this is in my telephone here, we have technology to put a very small device on their ankle, do the EKG, and that is transmitted to life. If I don't think it's of good quality, I say, give it another 10. They put a ophthalmoscope. This is a simplified version. But then on the advanced thing, we do biopsies, we do operate people with the robotics also. So technology, I think, is extremely important, very much patient-centric uh, uh, thing. And also in Pakistan, especially, it has become impossible. Looking at the numbers, one of my hospitals on the average has attendance in the OPD of 100,000 patients a day, like in our hospital. At Services Hospital, more than 100,000 patients, OPD, just OPD. It's impossible to retrieve their electronic medical record, except that we have to rely on EMR, electronic medical record. And then obviously no hospital can function or produce a quality without a respectable or an adequate hospital management information system. So you have to have not only electronic record, but also you have to communicate with pharmacy. So the old days have gone when our prescription would go suddenly in their pharmacy, and then they would struggle to find what doctor has written this, that. Now it's all electronic. Also, all the on the public health side, uh, to for disease surveillance like outbreaks of COVID right now here. So it's extremely important to do it with the IT. And I think the artificial intelligence which has come in, I mean, the, the advantage, the number one advantage to patient safety, because it identifies the guideline-based treatment, evidence-based treatment, intervention, and also any drug-drug interaction in any prescription, anything, it checks, auto checks. So that has improved a lot, and I think in the future, uh, people, well, right now even people are operating from New York, anywhere in the world through robotics. They don't, certain need not be there. And also, I think when we are looking at the future of medicine, it is going to see in medicine. Like we know that many medicine, like for example, I think Osman knows very well. Statin is a very big group of medicine that we prescribe. They all make it from almost all of them make. And they are growing by about 30 to 50% every year. New statins are coming in. Statins are there to reduce cholesterol, some extent, right? Right. And according to our studies, guidelines, and international guidelines, every diabetic should be on statin, every hypertensive, which means half of the participants should be on statin. Because at 50 years, every second Pakistan is hypertensive. And then every person who got a heart attack or a brain attack or a stroke must be on a statin. But when you look at the data, statins do reduce mortality by around, at the best studies after 4S and other studies, ASPOT, Alpha study is 40%. So to me as a prescriber, it means that 60% of the people were getting statins unnecessarily because there was no benefit. So now it is possible through technology to profile a person like me and him. So we can profile your genetics. We can look at your uh, status, your genetic status, and then develop, and we have already developed it for Pakistan, then develop a panel that whether you are going to respond to this drug or not. So why give you for 10 years with side effects, with price, with everything, and then say you are one of the non. So now we can predict what we call as precision medicine or personalized medicine. So you can say that this antihypertensive will be best for low renin people or high renin people. So you can profile the genetics, you can profile the biology of that person, and then feed into that system all the available medication, and then it will tell him which will be the best suited for this profile, but not for the other person who's coming behind. So this has all been made possible with technology. And I think without technology, now the mobile phone that we all have, like in our focus, it's not just, we have been very busy. We have not had our tools. We have been looking at this, treating patients. We are doing that every day. Uh, so, obviously, you need to expose yourself to it. Then they will be talking. This is one that the ivory tower, 90% public that goes to them, cutting one, and this is primary. Second aspect, mostly like that, what I highlight. But also, on the other hand, our healthcare spending not only is dismal, but Pakistan is spending about 1.9% of their scale at 1.9%. And then that spending not only quantitatively is static, but also qualitatively. Because most of the spending is aggressive, it's not progressive, and it's on issue based. Like then, like, so when you spend like this, you're never going to have. So unfortunately, that's how it is. But I think as the Pakistani, all need to play a role, all need to continue to educate, right, advocacy for health, prevention of diseases, and treatment of diseases. Let's do that, especially the educated class. Then our illiterate people or poor people, uh, I think this is the moral obligation to me and to people who are notice debate, say an advocacy role for people not to have access reasonable health. So, thank you. Uh, I think the question was that how this or with COVID-19. I'm going to focus on what we did
thirsty. Actually, as a health tech company, we're first sort of out to from immediate rush of demand for medical services. We ended up turning them on for free. Normally, we serve corporate and their employees. We said, let's turn this on for free. We started a program with government. We started serving up patients, doctors, and some of our doctors, about 40 to 50 doctors throughout the first day. So, I think that was really important. Everyone had saw that need. Some companies ended up serving their sciences and customers. For us, we've taken a focus on contribution to that. That was always at our core. And so we focus on how do we continue that. Today we're doing almost for 1,000 things a day. And that's just not something that so a lot of people when the word stops within the stores being shut down, people want to go outside. There are a lot of people who end up and I think we try to give the best possible discount at that time. We try to make sure that our availability is strong. I think that's why this large company was born. Probably to be the online market sort of solution. We merge these two entities so that the greatest platform and find forward further. For us, the core problems that we're trying to solve and Dr. Javed shared two very what Pakistan spends on healthcare today is very low with benchmark against other countries. And that spend is lopsided, right? Most people tertiary care and not up to primary care or prevention. The British left Pakistan with a very simple sort of health referral that set up basic health units across in every area. Let's go have them refer into the rural health centers. Let's set up trauma centers in the district to manage those things. And then all the demand will flow inward to a district healthcare hospital or a tertiary. And where the spend is just happening at the tertiary hospital, a lot of these basic health aren't even open to can start from them today. So how do you make sure those areas that talk to one quickest way to that's what we focus on. You talk. I think just like the that by stating how valuable uh, it's not just in terms of the we cannot know the great impact of and in the last interaction I had on did mention about how government and Hyder policy has uh, my I guess last question like has to do with what Pakistan will be the landscape country. Will we be a country that what do you see happening? Like, feel that even sort of that was often a kind of prosthetic one. There's like us that you know that different parts that it's kind of the country. So, you did touch upon your own, but where do you see sorry headed?
I think, and I'm not saying this to me, but yeah, it is like how to use technology. We think it creates indigenous data, and on that, on the picture of that technology, the future is very bright. have an entire generation. Look at the startup space in Pakistan. Very interesting subject area. Very encouraging. We use our common knowledge-based creativity to address this fundamental challenge, but it's definitely very important in Pakistan. But it's multiple developing countries. I think Pakistan is the one country that can develop a successful pilot, scale it up, take it to a start. I hope we take that risk. To require us to be innovative, require our regulators to be supportive and I think it's that basic amount of
uh, work in 5 countries, including US, UK. I think there's no place like Pakistan right now is the largest population. Year 2014, it's third largest population. India will become the population. China will become second population. So I think Pakistan is the largest country in the world. It is a matter of the thing will do, but that is the major challenge. But those for that we need continuity of policy. We all know what, but the implementation was policy shifts are so unless we have been elected right or we I don't know whether we elect or somebody else elect or elect whatever it is, but unless we have good leadership job, then that leadership should give it at the technical world. If you consider world 100 top hospitals, they give that they can help, they can other things. 9 of them are still being led by a partner. So there is nothing wrong with the partner. There is something wrong with the system. If we can set the system right and convert this population growing to the disadvantage because of the resources that we can always convert it by 20. So I personally think that Pakistan is inshallah will get because we are 95% Muslims with our age all that stuff. And I am sure that things will take happen even if I just want to say that is our problem and then human interference in the politics whether internet or so unless we in the health sector what we talk about technology in health unless in the health sector we have continued uh, policy. I was made focal person of book called Vision 2029 uh, by the last government of India. And then we worked for about 3 me and my colleagues uh, that come up with how the policy should be health policy. All here in my computer, the 35 minutes presentation. Tell you this by this authority, PMC, PMC or DRAP or whatever, what other agencies need to, what legislation needs amendment and what cost. Interestingly, the cost of the whole food was less than 3 billion. And the time frame required was about 7 months. But my last slide, because I presented this in the convention center when Prime Minister Nawaz was there and others were there. And the last slide was implementation. So there is no implementation. Unfortunately, health is a sector just like education, where the results will only come at the minimum after 10 years, then start coming. Look at Malaysia, look at Korea. They have activity of their policy and their so our leaders, when we propose them health reform, they say, okay, what will their only intention span is up to their election year, which is 1.5 years. I'm telling them to do this, strengthen their API system, basic health unit. They cannot have a basic health unit or health system for corona and then for dengue, for every disease. You have to just, you know, strengthen your infrastructure and your HR for health. And and it was a total unfortunately disconnect. But I think I don't see immediately the political will coming in somehow, especially now the election is only a couple of years, so everybody will be focused. They'll not be interested in a reform which is going to go beyond their election. They'll be interested in what can be done. So only tea and pitas and things like that. So, but outside the government, we can do a lot. So we should, and that is the main thing. In my university, I have 173 PhDs. So I called the top pharmaceutical industry. Said, I have got FDA, US FDA patents starting from interferon to biological skin, artificial skin. The artificial burns is Pakistan country with highest prevalence of burn. If you look at biological skin, 60 kg person who is burned, 50%, it will cost him no less than 3.5 million rupees for that. And resultantly, nobody can afford that. So the mortality remains around 95%. So if you are burned more than 50%, you are only 5% in Pakistan, even in the burn center. I put up 3 burn centers in Jinnah, one burn and reconstructive center when I was chief of Jinnah, and also in Gujarat. And I know the misery, I know the death and disaster. So we invented Pakistan. So we have done 170 patients and it's as good as imported skin. Our cost is only 90,000 rupees, and that cost is 3.5 million rupees. So, but it's not my job to commercialize. I can only patent it, do trials, show that it is equally good. Industry is needs, but they total disparate. They are okay with their generic things and it's not just a smile, it's the whole PPMA. So I don't know if one knows it or not. I gathered all the industry. I said I have these patents, 13 patents, US FDA, just upscale it. Upscale, put up in my biotechnology industry. Okay. They came and I said, okay, let's see some seriousness. Give 500,000 rupees each, collect the money so that we will serious. So they kept coming to my university and I kept meeting them. I said, elect their chairman. They could elect Rasheed Khan, I think. No, not the other. Yeah. Uh, another so they elected him and then we had meeting. He said, we even my Janan campus, which I just built on Kalashakatu, I gave them 10 canals land from prime land, build up the biotechnology plant here, the whole biotechnology. And they gave me after many meetings, 5 pages, about 70 points. One was concerning me about the land, the other were not concerning me. They were concerning the science and technology, draft, what about draft, drug laws. And this was despite Supreme Court behind me, but Supreme Court was so far that this connection is there. Now I have, at the university, I think this is first time in the world, I told all the industry, including proud of. Very well managed by him and his team. I said, we do designer research. Guest was the first one to take our computer and also Andawala. And saying Andawala, and the president of Pakistan was there, Arif Ali Saab, and he said, this is my year. I said, well, that's fine, but we told them, you have these PhDs at your disposal. You tell us what research you want me to design. So now it is the other way around. That we are not waiting. So these are the things we can do out of the box. We are willing to do. So we just because I personally think the biotechnology products in Pakistan can only be afforded by maybe 2 to 3% of people. Whether we talk of albumin IV, whether we talk of immune stimulating factor, we talk of growth hormone, we talk of insulin. I know insulin will never be viable to be made here because it's a game of volume. The fermenter size is too big. But small volume products, high value products can be made, and these drugs can be made very well. These are the four things that we can do on our own, but we need to collaborate. Our biggest problem in a health university like mine is that what we can easily do without government interference, maybe support or may not be support, is academia and testing partnership. So we can deliver to poor people quality drugs at a very affordable price.
So I think the question was that how do we see all this investment coming to Pakistan and what that means for our healthcare system? And how do we sort of prepare? Because I mean, my view is that no healthcare system is the same. I think Dr. Javed said the same thing. And probably for a country like Pakistan, a lot of localization of whatever is happening in any other country is needed. We're still a bit confused about state welfare healthcare. So what I see probably happening is experts who have worked in systems like Kaiser Permanente or United Health Group will come back to Pakistan, similar to how Dr. Javed has, and will start applying some of those things, but they need that bandwidth, they need that room to be able to execute. And that I feel the private sector support there. So in this effort to reinvent the primary healthcare system, it's probably going to be the private sector who's going to have to step up because of the challenges that we already talked about. And so I think that's where the opportunity lies. That's where the focus should be. And we're looking to healthcare experts such as the gentleman here to sort of support Bilal here in reinventing primary care.
Well, that brings our segment to a close. I'd like to thank the panelists, Osman, Waheed, Dr. Akram, and Hyder for taking out their valuable time to discuss very funny matters in health technology. And I'd like to thank everybody that attended. So that brings us to a close. And now is the time to distribute certificates to each panelist. So, my associate and over. So, I'd like to present the first certificate to Heather. I guess I'll get them all in one go. So, Dr. Javed, this is yours. You. Thank you all. Made it. We have the coffee and refreshments.
And this will be available online now.
Yes. Yes.